It is estimated that 35% of residents in long-term care homes die each year, and that number is expected to increase to 39% by 2020 as the Canadian population ages. This is just a hard fact of life. We all die, and as more Canadians live out their final years in residential care homes, more of us will die in the company of fellow residents and caregivers. That the death of a resident can be stressful and emotional for family members and fellow residents should come as no surprise, but it's also hard on the care aides, nurses, rehabilitation therapists, physicians, and other healthcare providers who work in residential care. These healthcare professionals often develop close personal relationships with residents.
Here at Langara, we had a team of clinicians who were recognizing that people were dying and that their colleagues were struggling, and they were worried about them. They were worried about burnout. They were worried about the impact on saying goodbye over and over again at fairly frequent rates. So a group of interdisciplinary clinicians here wanted to understand the impact of residents who were dying at this alarmingly increased rate. The opportunity arose as they met over lunch once, and instead of feeling powerless, they actually came together and started to think of how do we embark on a research opportunity that's going to inform what improvements we could do to help support staff, help support this home, our organization, and beyond in our greater system.
The response? Keeping the light shining. Through this project, the goal is to keep the light of resilience, hope, and caring alive in all staff.
The goal of our research project is to improve the well-being of the healthcare provider at the long-term care site at Providence Health Care. And through this research project, we identify the impacts and challenges the staff experiences. And we also identify the strategies that we can use to help the staff to take care of their own emotional needs and also professional needs, which in turn will help them to provide better end-of-life care for the residents and families. The research team consists of interprofessional frontline clinicians and also research expert mentors from UBC School of Nursing and Center for Health Evaluations and Outcome Sciences.
Completed in the fall of 2018, recommendations from the project include supporting caregivers in taking time to say goodbye to dying residents, coaching and training on death and dying, and having end-of-life conversations with residents and family members, providing the resources to support staff in comforting residents and family members during difficult times, maximizing the use of spiritual health services, and palliative outreach care team. Keeping the light shining has already yielded positive results, leading to an improved work culture where staff report feeling engaged and better able to provide the type of care that dying residents need. For fostering better end-of-life care for residents and their families by supporting the health and well-being of healthcare providers, the Gold Apple in Workplace Health Innovation is awarded to Providence Health Care's Keeping the Light Shining project. Generously sponsored by WorkSafe BC.